Hi everyone. So today we will see the current trends in nursing practice. This question is also asked many times in nursing management paper. So let's see what are the current trends. So we'll start our answer with some introduction. Okay. So trends in nursing practice refers to the evolving patterns and changes in the way nursing is delivered and healthcare is provided. What does trends in nursing practice refers to? What does it mean? So it means that there is evolution, there are some evolving patterns and changes so that the better care is delivered to the patients, so that there is improvement in the healthcare system, right? These trends reflect the dynamic nature of the healthcare industry. What does these trends reflect? The dynamic nature of the healthcare industry. Dynamic means vast. Current trends in nursing practices. While writing the answer, firstly you will write some introduction, and then you will make some diagrams, and then you will have to describe each and every point. Here I have not described, I have just drawn this diagram, but in answer you have to describe each points. Reduction in the distance through speedy communication. Line means there are various apps available through which we can consult the doctors by sitting in home itself, right? Then quality assurance in nursing care. There are various rules, regulations in a particular organization evaluate the functioning of nurses in order to see that the desired goal is achieved. Continuing nursing education, where the nurses are encouraged to attend webinars in service education. Also some nurses go for MSc and PBSc. The next is nurse patient ratio. In many hospitals we can see that the nurse is allotted with 12 patients. Yeah, in that cases nurses are not able to work properly. They are not able to provide proper care to a single patient. So this is seen in many researches. So it has been concluded that the nurse patient ratio should be reduced. Nursing audits are conducted so that it is seen that the nurses are working properly in order to meet the goals of the organization, in order to provide proper care to the patients, right? Then independent nurse practitioner is where the nurse practices or provides care to the patients independently, without any orders given from the doctor. This is not mostly seen in India. In other countries, you can see nurse practitioner working independently. Technology integration, wherein there are various technologies like telemedicine, EHRs, where the communication is faster. It is useful for immediate management of patient. Decentralized approach towards care management. Decentralized means overall, right? So overall approach towards care management is done. Then evidence-based practice. Nowadays, whatever procedures or protocols the hospitals are following, or the nurses are following, are evidence-based. Conduct of nursing research is important so that new protocols are made, positive changes are made in nursing practices, so that better care is delivered to the patients. Higher education for senior position. Earlier senior positions were based only on the experience, right? But now we also see the education as well as the experience. For example, if we have a nurse who have done her MSc and has experience of suppose 2 to 3 years, and we have another nurse who have experience of suppose 5 years, and then we are choosing one person for the senior position, so obviously we will choose a person who have knowledge as well as experience, right? So these were some current trends in nursing. Now let's have a look at issues in nursing practices. Issues in nursing practices. So the first one is shortages of nurses. So many nurses are going abroad in order to have a better lifestyle, in order to get good wages, workload, improper nurse patient ratio. So these are some reasons for shortages of nurses. Then the scope of practice. Many people have an idea that nursing is only related to working as a staff nurse or a tutor, but there are also scopes like nurse researcher. Renewal of nursing registration. In many cases, it has been seen that many nurses face problem in renewal of nursing registration. For example, when a nurse is transferred from one state to other state, or after certain years there is renewal of registration. So the process is not very easy. So ethical dilemmas, nurses has to follow many ethical rules and regulations, and a nurse is always under burden of the rules of hospitals, under her supervisors. Specialization in clinical areas. Now, how can specialization in clinical area be an issue in nursing practice? This is mostly seen in nurses, in freshers. Like many freshers want their duty to be in ICUs or OTs. Yeah, they don't want to work in wards. So this specialization in clinical areas may lead to shortages of nurses in ward, and the ward nurses have to, like, are appointed 12 patients at a time. Technological changes, with the evolving technologies, with the new technologies like telemedicine, etc. So the nurses have to keep them. So the nurses have to learn the new technologies, the new machines in the organization. So this can become a problem, not a problem, a challenge, you can say. Then legal issues. I had already talked about that the nurses are under various ethical rules and regulations. The nurses has to follow each and every rules and regulations, has to take care of the patient. Also, she also have to look that the patient is taken care of, the relatives are taken care of. Also, she meet the needs of every patient. She also follows the doctor's orders properly, and she doesn't break the rule of organization. So this can sometimes be very stressful. This can burn out the nurses, right? So these are some issues in nursing practice. Here I have just made a diagram, but in exams you have to make this diagram as well as you have to describe each and every answers. Okay, I hope found this video helpful. Please like, share and subscribe. Thank you.